number of cases, as we can see, is increasing over time, and what we have is the total number of deaths from 95 to 2013 at 2,865, but we have a total of cases which is clearly more than 250,000 from the same time period. As many of you will be aware, scientists among you, there are 4 dengue serotypes. Next slide. So there are 4 dengue serotypes, and these are mainly, these are labeled 1, 2, 3, and 4, and we'll discuss their distribution within the region a little bit later, but we have all 4 serotypes currently circulating within the region. A little bit of history for you, and this is again providing some background and letting you know about when the first outbreaks of dengue were identified in the region. And this has been since the 1600s, and Martinique and Guadeloupe, as you can see, were the first areas affected. And then we have a description of an outbreak in the United States. And then in 1827, there were various multi-country outbreaks, as well as in the early 1900s, an epidemic of dengue in South America, Panama, Chile, and part of Argentina. This particular graphic gives you an idea of how dengue in the Americas has been increasing over time. And again, if we're looking at that in early 1980s period, so it's 1980 here, and then moving up until 2012, we can very clearly see a very large increase in cases, quite significant, and we have a very large outbreak in 1981, where more than 250,000 people were affected in Cuba. And when we look at this in a little bit more detail, what you will see is that generally every 5 years there appear to be epidemics or outbreaks of dengue across the region. And this is quite significant in that it allows us to know when we should really start preparing. So yes, there is the rainy season when we need to be preparing during the rainy season, but we can actually prep our health services because we know in general, every 5 years, we would expect a very large increase in the number of cases. This is now more specific to the Caribbean, and on the left, this is the Caribbean here, clearly, and what we have are dengue at the top, and dengue hemorrhagic fever a little bit lower down. The dengue hemorrhagic fever, as some of you will know, is now more correctly called dengue severe dengue. And again, what we see in the Caribbean, as in other parts of the Americas, is an increase in the number of cases since 2001 and 2013, and again, that sort of spike every 5 years or so, which indicates an increase in, is an epidemic or an outbreak. Excuse me. If we now look at dengue in terms of non-Hispanic countries and Hispanic countries within the region, what we again see is a very similar pattern in terms of the increasing number of cases, but this increase appears to be greater in the Hispanic cases than it is in the non-Hispanic cases. Now, I'm not clear whether that is due to better efforts in terms of prevention and control, but this is something, again, which we can discuss later on. Genetics. In terms of the distribution of the various dengue serotypes, as previously stated, all 4 serotypes are circulating in the region, but clearly all 4 serotypes are not circulating in each country or territory at the same time. And as we can see, generally most have 1 to 2 serotypes, some have 3, and one particular island has just a single serotype that has been identified to date. And then if we now look at this in a little bit more detail and over time, what we can then see is that the circulating serotypes in each of the countries appears to change a little bit over time. And what we will also note is that in some of the countries these remain stable, but in others there is some variation. And usually when there is a bit of variation, then you generally then tend to expect an outbreak to occur. Reasons for dengue spread. And I think many of us are aware of what these are, and some of these have already been highlighted by some of the previous speakers. But I think if we look at some particular ones here, uncontrolled and unplanned urbanization. We're very aware in Trinidad and Tobago about how there has been a recent increase in flooding. There are new developments going on everywhere, and part of this is down to the urbanization that is happening within Trinidad and Tobago and potentially across other parts of the region as well. Poor environmental management, very similar, and I will show some pictures to illustrate that in the next few slides. But what is really, again, important here is the insufficient resources for national vector control programs. And so therefore there is actually a need for us to be able to increase our capacity and our capability, particularly in terms of human resources and other resources that are targeted at vector control programs. Part of that, again, will also come down to how we resource laboratories and how there are sufficient resources provided for us to determine what is the insecticide resistance of these particular mosquitoes across the region. And so here we see some of the issues that we have and which are contributors to our particular challenges in terms of trying to prevent and control dengue. And we should also bear in mind that these would also be similar for chikungunya as well. And in particular, disposal of used tires. Tires do collect rainwater, and as they are, as you can see here, you would very surely find mosquito larvae within these disused tires, and then these work as a breeding site for the mosquito. Storage of water in various containers which are uncovered, providing open access for the mosquito, are very, very fertile breeding sites. Flood water here, as we can see, or water that is not draining away due to unplanned urbanization. Incorrect application of insecticides is very important. There is a particular methodology for doing this, and what we have seen across the region in some countries is that the application, if we look at this particular, the top left hand, the bottom, well, the top and bottom, is what we call fogging. And so therefore there is the application of the insecticide to a general environmental area, and at times this is not done in the correct way, and it's not done in a sufficient number of times to actually have an impact on the mosquito itself. And therefore that then contributes to our issues or our problems by breeding insecticide resistance within the mosquito population. And so therefore we need to be very sparing of how we use the insecticides and use them appropriately. But I believe that presentation that will speak to that a little bit later on. When we talk about surveillance and response, there are various areas here which are should be part of an integrated management system in terms of dealing with the dengue situation, and again you'll be discussing this a little bit as well. Of particular importance are risk communication and social mobilization, because clearly without those, the community will not be able to deal with the situation. Really, this is something that needs to be dealt with at the community and the individual level. People need to take responsibility for their environments. It's very, very, very important. Monitoring and evaluation, sometimes called the weakest link in our the challenge that we have with dengue, and there are a number of indicators that are used to identify how we are progressing in terms of the challenges posed by this particular disease. But going back to monitoring and evaluation, it's very clear and very apparent that we implement a lot of measures in order to prevent and control dengue, but these are very rarely assessed, and there is a need for us to do that as well. This is the integrated management strategy that I mentioned earlier, and you will have seen many of these indicators in the previous slide, but clearly the aim here is for us to reduce as much as possible the considerable mortality and morbidity that is associated with dengue as well as severe dengue, and also to understand that these issues can also, this strategy can also work for chikungunya as well, which is clearly working its way down across the region. So in closing, what I would like to say is that clearly this is a clear and present threat for us, and as has been said by previous speakers, the rainy season is upon us, and we need to take due care with our environment. We also should note that World Health Day recently this year also highlighted the problem of vectors and vector prevention and control, so therefore the small bite big threat issue is again something that we should also bear in mind. And CARPHA itself has also proposed a mosquito awareness week within the Caribbean region, and we are working with partners to make that a reality. Okay, I'd like to thank you very much for your attention.